LANAP is not indicated, but the majority of my cases, probably 90% of my cases, my treatment of choice is LANAP. There we go. And so, again, these are just some examples here of vertical defects, problems in the furcation. We went ahead, did LANAP on the patient. We have bone growth here, at least the furcation's closed up now more. But again, no extra cost to the patient, no cutting, no sewing, no extra materials that we have to add in hopes that we get bone growth in these areas. I find that bone growth with these vertical defects is more predictable with LANAP than it is with traditional gum surgery procedures. The next case I'm going to show you, and we're going to wrap it up pretty soon. I've just got a few slides. This case is actually one of my favorite cases to show because it's just the start realization of how powerful LANAP can be and how useful this laser is. This is a diabetic patient. She's not very well controlled at the time. Her husband called me up and said that she was just basically bleeding spontaneously, wake up in the morning, bed sheets covered in blood. I know it sounds kind of gross, but that's what it was. She came in, she's crying, she needed treatment done. I think I had the laser maybe 6 months. I'd been doing LANAP for about 6 months, still kind of getting my feet wet on it, but feeling a lot more comfortable. I said, look, I've got this laser treatment. Let's see what can happen. Went ahead. Now, don't forget, the LANAP is one treatment. It's one time. You don't go back multiple times to treat it with a laser. This is a one-time deal for this patient. We may do half a mouth and a half a mouth, but it's only once. This is what she looked like 4 weeks later. Ooh, there we go. Now, if you saw that patient compared to what she was before, and now you see her now, you can tell that this is a very powerful procedure. And here's her lower teeth, which is when you see the next results, you're going to be impressed. I know I am. But you can see how the gum tissue is basically pulling away. Scale and root plane is really not going to work. She couldn't even brush her teeth. So she's just falling apart at the seams here. And here's what her mandibular teeth look like after LANAP. Now, if you saw that patient in this type of situation, you go, oh, she really needs to work on her hygiene, but you would never think that she looked like that. So does LANAP work for severe cases? Yes. Does it work was she a severe periodontal case? No, she still had a lot of good bone, but she was a severe case from a tissue standpoint. So I use LANAP wherever I know it's going to be of a major benefit to the patient. So let's wrap it up. And what are the advantages to LANAP? Well, we get little to no recession. Therefore, we get little to no postoperative discomfort for the patient and very little, no postoperative sensitivity. It's a full mouth procedure. So as a periodontist, I find that before I started LANAP, patients would maybe get half a mouth done, then wait a year to get the other half done, or if they were lucky, they didn't come back for the other half. Sometimes you just lost patients because no one just wanted to have the treatment done, traditional surgery. Once you do LANAP is a full mouth procedure. Patients have to be committed to doing the full mouth. So if you think of extermination in your house, if you have bugs in your house, you don't tell the guide just to do the bathroom because you didn't see any in the kitchen. He's going to say, no, we do the whole house, because even though you may not see the bugs there, they're there. They're just waiting for the right environment. Same thing with periodontal pathogens. They may not be, the area may not be fulminating, but they're there waiting for the right environment. It addresses the periodontal disease not only mechanically through the scale and root planing part, but at the bacteriological level, which unfortunately the traditional gum surgical methods don't do. They just address periodontal disease mechanically by resection, by amputation, and hopefully get rid of the bacteria. But this is addressing periodontal disease at the bacteriological level also. We saw in the past bone regeneration is possible without additional grafting materials. What does that mean? I don't have the patients. It's overall less expensive for the patient, not only monetarily, but appointment times. If I can do a full mouth in one appointment, 2.5 hours, and have them go back to work the next day with very little to no discomfort, they're much better off. I'm much better off. I don't get calls in the middle of the night. I don't have sutures come out. I don't have bowel sloughing, etc. We don't do pre-surgical scaling root planing anymore. If you go to the website, if you're not familiar with the LANAP procedure in terms of the steps, scale and root planing is part of it. So now they don't have to go through pre-surgical scale and root planing. So we don't have to do that. It's more conservative than traditional osseous surgery. leaves me many options available. I can do traditional, I can go back to the laser, so the options are greater. Once you start surgery, you can't keep cutting and cutting and cutting. At some point, you're stopped, and the patient's going to be in a very compromised situation. The nice thing is about the Periolaser is that we can stop bleeding no matter what. That's the nice thing. We can develop that nice, beautiful biological bandage, that blood clot, no matter what. So I don't have to take patients off blood thinners. I don't have patients off Plavix or Coumadin. Cardiologists spend a lot of time trying to get their patients just on the right amount. They titrate them very carefully, and what do? Take them off it when we're doing surgery or scaling root planing or whatever. With LANAP, I just go right to work, and that's it. I don't take the patients off. There's no sense of the patient having a stroke just to try to save a tooth. I want to thank you for all your time and listening to me.